is Carmen. I'm the outreach coordinator with Family Service of Tulare County, and I'm here in the Food Link kitchen to talk to you about what do we provide as an agency.
So Carmen, do you want to go about letting people know what is Family Services of Tulare County?
Family Services of Tulare County, we're a nonprofit that serves Tulare County in many different programs. Our mission is to help families, adults, and children heal from violence into healthy relationships.
How do you guys do that? I'm assuming you guys have some programming. What does that program look like, and how does it help those adults, children, and families thrive in healthy relationships throughout Tulare County?
We have different programs. We have from domestic violence. We have Karen's House, which is a shelter. We also have supervised visitation, which help the parents to visit their child that they're not in custody, or to do a safe visitation or exchange. We also have supportive housing. We have human trafficking services, our Freedom House, which is a youth drop-in center, which help youth at risk of being trafficked. We have sexual assault services, help with a hotline when someone was sexually assaulted. Doesn't matter how long it was, we still provide the services, and it does not require for the person to report to the police. We also have mental health, which is our counseling and children counseling here in Tulare County, and with that we help not only victims of violence, but we also do general services for anyone can get help through our counseling center.
How do people get in contact with you? How do they seek out these services?
They can do it through our website at fstc.net. They can also call our hotline that is going to be here below. It could be our domestic violence hotline, it could be our sexual assault hotline, or they can just call our administrative office, and they'll provide you or send you and forward your call to the department that you're looking for. Doesn't matter what program that you call, they can always transfer to the one that you're looking for.
Can you give us hours and time frames for maybe your domestic violence shelter, right? I believe that's a 24-hour program through holidays and everything. Is that correct?
Yes, it's a 24/7. So if anyone it's a confidential hotline, they can call. Someone is there to listen. If you are ready to leave your domestic violence relationship, we have a place that you can stay with children. It could be woman and man, and we accept children. We accept all genders.
And then what about the other programming? Is there time frames limits to that?
Some of the programs have an 8 to 5 schedule, Monday to Friday, and our sexual assault is also 24/7. Our hotlines are ready for our hotline is ready to answer to those survivors and victims. If they don't know what to do, they're there. We don't provide, we don't give the people or tell them what to do. That's an option. We give them the possibilities of what they want to do at that time. Sometimes someone it might be ready to leave, but sometimes it's not safe. So we always provide just an option, and they decide what to do.
Do you guys provide follow-up care, so someone has been sexually assaulted and they want to go through the process of maybe going to the hospital and providing a police report? What does Family Services do in that case?
Well, whenever someone is sexually assaulted, we are the ones that we have a victim advocate that responds to the hospital, and they're ready for, they're there to help the victim, not only morally, but they're there to support them anyhow. They're there to look for the rights of the victim. After that gets done, if it gets done, we're not the ones to approve that. That's done by the police. After that's done, we have a case we have case management. We have a victim advocate that is going to call, follow up with the case. If that person needs to contact whoever agency, it could be the police, it could be other partners agency, that person is going to help you. We also have a therapist on site that speaks Spanish and English. So if that person needs therapy and wants therapy, they're there too for their support. We also have some funds available for them if they don't have clothes, if they cannot go back to their house. We try to help as much as we can. Maybe they don't have food, so we try to help as much as we can. Depends on the situation and what we're able to do. I don't want to say that we give them all, because sometimes we don't have funding, but I just do want to say that we try our best to help our clients at that time.
Okay, so you're really there to offer more like support, and then whatever resources you can at the moment, you just fill in that gap.
Yes, we always refer out. If for some reason we're not the agency that helps, we have collaborative partners that we refer out, and maybe that person doesn't want to stay here. They're looking to move out of this county for some reason. We also try to accommodate that and look for a resource. It might help to the place that they're going to.
Okay, that's amazing, and that's a resource. The referring out, the vouchers and stuff. That kind of floats through all the programs, like the domestic violence shelter and the supervised visitations. If you guys see parents who may need that type of support and help, right? Those are things that like pretty much all the programs do.
Yes, we work with each other. I do want to clarify that even though we are different programs or the agency, your confidentiality is very important to us. So some of the times we don't share with all the programs. We only share what the clients allow us to share with the other program. So that means if someone is going through counseling but doesn't want any of that person is getting assistance through other, and they don't want them to know, we can't. So we really take serious confidentiality. Also, just with food link, if someone needed food, we try to look where is going to be the next place, and we have vouchers. We might give them some, but we try to refer out to different organizations, just from mental health, alcohol and drug abuse programs, housing. We might not be able to help. We do have a supportive housing program, but if there's a list, maybe they don't qualify, so we always try to help out.
Okay, that's amazing. You guys do amazing work here in Tulare County, and we're so happy to be community partners with you. And then, so can we kind of break down, like, where do you guys serve? Like, I know you guys have offices in both Visalia and Porterville, but that's not where you can find the serving. It's a whole county-wide organization, correct?
Yes, we serve Tulare County, so any person that lives in Tulare County, we can serve to them and provide our services. Most of our offices are in Visalia. We have a supervised visitation office in Porterville, but most of our offices are in Visalia. If for some reason that person cannot come, we try to connect with the resource centers, and we have some more therapists out there. And if the person cannot drive or doesn't have money for the bus, we always look for buses. We always look to give maybe some gas vouchers for that person. And some of the time there's a one-time thing. It doesn't mean that every time that person needs to come to Visalia or to get the services, we're going to be able to. Not because we don't want to, because recently we're not able to do it, to give a $20, $15, $10 to a person each time. We do have, how I said, buses that your victim advocate or your caseworker or the person that is helping you with the case can provide. We have legal clinics that used to go to different places in Woodlake, in Cutler, Rosie, and right now we're doing it through Zoom, so it's even easier. Being in Tulare County, transportation is one of the biggest barriers because we're so big. We're the size of Connecticut, and for someone to come to Visalia, we understand that it's hard. There's a barrier in transportation to receive services, but we do everything that we can to kind of help the person or the victim to receive the services. I know sometimes it's hard, and it's also hard for us, but it's so much that we can do.
Okay, so I mean that eliminates a barrier just to like at least get assessed and everything. So we have our people in our rural areas like Pixley, Tipton, Taviston, Allensworth being able to utilize those services this way with the bus vouchers and different types of things that you guys provide to help with transportation. But given the situation with COVID currently, how does that look like providing services and people getting access to your services?
Family Services had to realign the way that we provide services out to the public. We have to protect the safety of our clients, our volunteer, and our staff. Thinking of making sure we provide the best services that we can, but also taking care of the person that are providing the service. So our crisis services are available Hospital, just outside Karen House. It is open, it's still running. We are taking some precautions just from whenever someone is coming in. We ask a few questions. If they think they might have been in contact or have that COVID-19, we have to get a clearance from the doctor for them to able to come in. We also might have some hotel vouchers available for them meanwhile they wait to get the services. And we're just taking precautions by cleaning, by washing hands and disinfecting Karen's house. Also, our hotlines are available 24/7. How I said before, our domestic violence hotline, our sexual assault hotline, and our human trafficking hotline. Also, the Freedom House is still providing some services. Freedom House is our youth drop-in center for human trafficking. We are providing Zoom calls, video calls. We're trying to limit the interaction with in person. So most of our offices, we're still working. You can contact us to the same, if you're already a client, you can contact to the same phone number and to the same email. Our contacts are still the same. Our offices are closed out to the public. Most of them are done by appointment. We're working with Zoom a lot, just from doing presentations, webinars, clients, counseling, supervised visitations, in-home parenting is doing conversations via Zoom or video call. So we're working remotely from home, but we're still trying to provide as much as we can to the community. The only services that we are canceled or postponed, it will be the in-person outreach or our work in our schools until they reconvene for students to go back. And our Goshen Family Center, which is located at the Goshen Elementary School, so that's being closed until Visalia Unified School comes back. Also, our Ryan White programs, now it's starting July 1st. The services are being provided by our collaborative partner, the STARS. We're still providing HIV services, but more of a short term. The Ryan White provides more of a long term.
Is there anything else you would like to add about your agency? Maybe are you guys in need of volunteers or any type of assistance or help right now getting through COVID?
I do want to add, which I almost forgot, is our DB chat line. That one, we just recently launched a website hotline. So if anyone is going through any kind of domestic violence situation, they can go to www.fstc.net/help. They can talk to a victim advocate. Someone is ready that have been trained to respond. Sometimes we understand it's not easy to talk to someone when your aggressor is there. So that could be, you don't have to say a word. You can just, you can do it on your phone, in your computer, and it's easy to exit. So if that's something new that we have in our functions in our website. If there's anything I did not say clearly that you do still have a question, you can go to our website, and then we have all the programs. Also, you can download our flyers from each program. We do have an all agency flyer that has all the numbers. We do have a specific flyer for some of the programs, and it's just there. If you are in need, you need someone, we're here to help you. Just call, and if for some reason you call the wrong number, they'll make sure that they transfer to the right one.
Okay, awesome. Thank you so much, Carmen. I hope that was helpful to anyone who may be needing these services. Here at FoodLink, we are wonderful partners with Family Services of Tulare County. We thank you so much, Carmen, for coming in today and sharing those services. Again, all the things that she mentioned, the numbers, the hotlines, and everything will be posted under this video. So if you need those services, you're more than welcome to click and get what you need. All right.
Thank you so much for having us with Link. It's great to work with you guys, and if anything, just how you said, we're here. Thank you.